So this video is for the assessment for how to control infectious disease. So to start off with, I'm going to describe and demonstrate general, describe the disease in general. So the disease that I'm going to be doing today is the canine parvovirus infection, which is a relatively new disease that appeared in 1978. It is highly infectious and generally attacks the gastrointestinal and cardiovascular system of dogs. The main source of the virus is feces of infected dogs, and this can be spread through any contact with feces or any part of the dog. It's a highly contagious virus, and the animal itself generally is infected by ingesting the virus through other fecal matter. But as I said, it can be transferred just by a dog touching or going through the same area that a dog has been that's been infected with parvovirus. So basically this virus has a high contagious rate, as I said, and is resistant to a lot of different types of effects, including heat, detergents, and alcohol. So therefore it can remain in different environments for up to a year after the dog's been there. So this is why it's essential to vaccinate your dog, because vaccination increases immunity and therefore decreases or even minimizes the likeliness of a dog contracting parvovirus. So the best way to prevent the spreading of this disease is in a puppy, is actually not just vaccinating the dog, but keeping the dog at home until the dog, the puppy itself, has grown up into a size and to a certain age where not only has it been vaccinated and is immune, but also minimizes interaction with other dogs that, again, could have picked up parvo or have remnants that could be vaccinated, hence why they don't have it. So minimizing exposure and vaccination is one of the first ways to do that. On top of that, cleaning or disposing of any clothes or sheets or any form of physical kind of, cloth, etc., that's been in contact with it. So you can either bleach it and wash it, or you can throw it out. It's up to the person. So that's pretty much that. So basically the next phase of this is now to describe and demonstrate the signs of disease. So basically, general signs and symptoms of a dog having viro is sudden onset of bloody diarrhea, lethargy, unwillingness to eat, and repeated episodes of vomiting. It is also important to note that not all dogs show clinical signs of contracting parvo if they have. So it's just it could take a while, up to 7 to 10 days, for a dog to start showing symptoms. So it's a highly important to get immediate vet attention if any of these or a combination of these symptoms are visible in the dog. So demonstrate the actions that would need to be taken for the animal affected and the animals in the facility for the outbreak. Okay, so if there was an outbreak in a facility, it's essential to isolate any dogs that have known symptoms or is positive. And they should remain separated at all times to minimize viral contact with floors and other clients, both humans and animals. So in this specific clinic, there unfortunately is no isolation room. So this is just the kennel part. So I'm just going to use this as a mock simulation of if it was an isolation room. So so basically, any dog within the clinic that could be potentially exposed to this virus also should be quarantined and then appropriately tested to confirm that they have not picked up parvo, because, again, it's a very contagious disease, and it's important to make sure that a dog that could be potentially contracting it is also isolated at home until there is a negative test to within the appropriate time frame to definitely rule out any infection likeliness of that dog. So so also it's important to communicate with other staff members when and if an outbreak occurs, so everyone is aware of and can follow the appropriate isolation protocols in a clinic, and also wearing of the appropriate protection, personal protection equipment is also essential. And generally speaking, in an isolation room, whether it's disposable PPE or fixed or reused clothing and items, it's essential to dispose of them properly or to clean them properly. So again, Generally speaking, isolation equipment that's going to be cleaned needs to be done so separately. It's also good to soak it in bleach if you're going to use it, and to then wash it separately with the other garments to again minimize contraction and spreading of the virus. So so the best treatment for parvovirus is basically to ensure that young dogs are vaccinated, and again separated when they're young, so they can build up immunity and grow into healthy dogs that will not contract it due to vaccination and building of personal immunity, etc. So as far as that's concerned, if a dog does have the virus, then the first step in treatment is to correct dehydration and electrolyte imbalances. This requires the administration of intravenous fluids containing electrolytes. Antibiotics and anti-inflammatory drugs are given to prevent or control septicemia, and antispasmodic drugs are used to inhibit diarrhea and vomiting that perpetuate the problems. So basically there's an array of different drugs using that combat different signs and symptoms depending on what the dog is experiencing. And again, within further, like after a couple of days, these specific outcomes or consequences of contracting parvo will be minimized and most likely not happen if the dog's treated early and on time. So most dogs with parvo infection recover if aggressive treatment is used, and if therapy has begun before septicemia and dehydration occur, then again there's a higher likeliness of survival of the individual dog. So just a fun fact that different breeds have different fatality rates, again genetic predisposition to viruses, etc. But again, that's just a fun fact. Okay. So describe and demonstrate patient accommodation in the isolation area. So basically, not only for the dog's comfort, but also for the whole clinic's sake, it's essential to have good ventilation, which is some form of fan that actively pushes air outside of the isolation room so it doesn't have a build-up, so that, if you open the door, like if there wasn't proper ventilation, there'd be more parvo particles kind of in the area, so it's essential to kind of keep a healthy flow. Keeping standard room temperature is also important. If extra temperatures, if extra heat's required, then providing relevant heat sources, or again, if or otherwise ice packs, just depending on the situation. So again, the bedding and all of the other related items would stay in the isolation room, and making sure that there's good size cages and enough, of course, for different patients is also essential. So just making sure that the whole room itself is designed appropriately to deal with cases of isolation or disease outbreak. So, okay, describe and demonstrate the equipment kept in the isolation ward. So there's a whole different array of protection PPEs as far as isolation rooms are concerned. So generally, depending on the clinic, they have different types, including like as far as body protection PPE is concerned, they have non-sterile gowns. You can use lab coats or overalls, or you can even use disposable or reusable gowns, depending on the clinic. Again, if they're disposable, then disposing of them appropriately in the isolation room and then transporting that immediately to the designated bin or is highly essential. But if it's reusable, then soaking it in bleach before bringing it to the washing machine, or even more ideally a separate washing machine, then that would then be the appropriate way to move forward with washing PPE. There's also gloves, masks, for respiratory protection as well as face protection. So there's also like protective eyewear, so you can have like an eye mask or eyewear, and also having specific footwear, whether it be shoe covers or removing shoes or keeping shoes limited to the isolation room as to not transport virus throughout the clinic is it's extremely important. So so food preparation. Again, generally speaking, not only are the bowls kept in the isolation room, but again, they should be washed appropriately, both with bleach and dishwasher detergent, and then left to dry, and then stored in a safe and in a safe drawer that's, again, has some form of protection and is also organized for convenient access. So again, depending on the animal, so let's say, I'm just going to hypothetically do this because I don't want to waste food. But let's say if I was wanting to feed a kitten, there's a healthy development diet, for example. So again, I would get the bowl that's kept in the isolation room, put the food in, dispose of the food appropriately, feed the food to the animal, again with water, whatever's necessary. And then once again they finished, disposing or cleaning in the appropriate way is then essential in order to make sure that there's no leftover parvo on any form of bedding, food, or anything like that. So describe and demonstrate daily cleaning. So generally speaking, there would be like, again, cleaning protocols. So vacuuming and mopping on a daily basis would be essential. Making sure that the mop is only kept in the isolation room and used in no other part of the clinic is also important. As far as like, yeah, so that'd be vacuuming, mopping, general cleaning, which is either using F10 or bleach specifically, depending on the situation again. So step by step, in the morning you come in, give the place a mop, give everything a clean wipe down for the day. Again, depending on if a dog was admitted with parvovirus, like once the dog has been discharged, then cleaning appropriately to make sure that there's no leftover virus or bacterial germs is an essential part of protocol to, again, limit transmission and to prevent future infection. And the waste disposal, so again, if there would be a bin and specific items that would be purely for the isolation room, and